Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a young and a very brilliant Dr. Suresh Raghavaya. He is a multi-organ transplant specialist and he is concerned about the health of the people. And that's why he wants the people to know what are the options and not to worry. And today he is with us to explain about the liver cancer. How to make out the patient has got a liver cancer? Please let us know.
Hi, Dr. Jalashmi. Thank you so much for having me on the show. It is always a pleasure being on the show. So, the thing about liver cancer is, unfortunately, it does not produce any symptoms in the early stages of disease. Like I've always previously said, until about 60 to 70% of our liver is damaged, the patient will not have any clinical symptoms. And this
Oh,
is the unfortunate thing about liver
very,
cancer as
very,
well, that
yes.
most patients do not catch liver cancer early. And this is the importance of surveillance of liver disease. Now, who are
Okay.
the patients who need to be under surveillance? Anybody who is diabetic or high cholesterol levels are generally more prone for fatty liver disease. Now,
And
why
who's
is
an
fatty liver disease?
alcoholic and
Alcoholics
alcoholic.
is 100% they need to be under surveillance because it exponentially increases the risk of fatty liver and liver cirrhosis.
Hmm.
Now, once they develop fatty liver, they are at risk of developing cirrhosis of liver, and cirrhosis of liver also has a risk factor for turning into
Hmm.
cancer. Now, if
Hmm.
you're a hepatitis B patient or a hepatitis C patient, if you're unfortunately suffering from it, or any other liver disease like autoimmune hepatitis, primary sclerosing cholangitis, PBC, these are the risk factors for cirrhosis, which puts you at a higher risk for liver cancer. So these patients
Okay.
have to undergo surveillance. What are the
Okay.
surveillance? Very simple blood tests. Get your blood sugar level checked, get your cholesterol level checked, and get your
Hmm.
liver function test. Next is a
Okay.
simple screening method, is an ultrasound, commonly available everywhere, and it is very cheap. Now, what does the ultrasound tell you? It tells you what is the architecture of the liver, what is the function of the liver, how much fat is there in the liver. It is going to tell you, and more
Okay.
importantly, specifically talking about liver cancer, if it will tell you whether there is any early liver cancer which is developing in your liver.
Okay.
Now,
Hmm.
if at all you have fatty liver, the next thing you have to do is always get a fibroscan of the liver. Why?
Hmm.
Fibroscan is going to tell you how much fat is there in the liver. At the
Hmm.
same time, it is also going to tell you how much of a damage the fat
Hmm.
is doing to the liver. Now,
Hmm.
let us say the ultrasound has picked up a small lesion. Now, that can be a
Hmm.
simple thing like a hemangioma, which is nothing but
Hmm.
an abnormal blood vessel collection in the liver, which does not technically need any treatment until symptomatic. Now,
Okay.
if it is a tumor, it can be a benign tumor where you don't need to worry about it all. It could be a fat, it could be a fibronodular hyperplasia, especially young females, or it could be an adenoma and cancer. Now, how do you
Okay.
differentiate that? Next thing, you go get a CT scan, what we call as a triphasic CT scan. Now, this will
Okay.
definitely tell us what the character of the tumor is going to be, whether it is a liver cancer, whether it is a secondaries, whether the cancer has spread
Okay.
from somewhere else. It
The
is very
other
important for
organs.
us to
Yeah.
know that. Yes.
Hmm.
Now, even if we don't know in the CT scan, we can do an MRI scan, and that will
Hmm.
also delineate what the tumor is. We can do a blood
Okay.
test for tumor
Hmm.
markers like alpha fetoprotein, CA99, CEA, and the
Hmm.
latest one is PIVKA2, which is very, very
Okay.
specific for liver cancer. And
Okay.
despite doing all these things, if you're not able to make out what the disease is, the simplest thing is get a small biopsy,
Hmm.
do the staining. We have special stainings like immunohistochemical stainings,
Hmm.
which will
Hmm.
pinpoint what this cancer is. So,
Oh.
there's various armamentarium to actually
Hmm.
diagnose if at all you have a tumor in the liver, and
Hmm.
most of these are not very expensive.
Hmm.
So I
Hmm.
would
Hmm.
suggest that everybody goes into surveillance, get the simple test done if at all they have a thing, so that you can, most important thing is you can get treatment early.
Okay, okay.
Hmm.
So the people don't have to worry. Only thing that they have to go to the specialist and get it investigated and to make the perfect diagnosis. Now,
Absolutely, ma'am.
once you have
Absolutely.
the diagnosis, you know what it is. How do you go
Hmm.
about? What are the
Very
treatment
good.
options?
Very good. So liver cancer right now, see, initially when I started my career, whenever you say liver cancer, they will immediately take the patient, go home saying that, sir, liver cancer,
Hmm.
I don't think it is worthwhile doing any treatment. We're just going to take
Hmm.
him home,
Hmm.
which is
Hmm.
not the case at all right now.
Hmm. Hmm.
Multiple treatment options are available, and most of them do extremely well
Hmm.
with treatment. So whenever it comes as liver cancer, the first treatment of choice is always surgery, because surgery gives the best, what we say, disease-free survival and longevity and the potential for cure as well. If at all we catch it early, we are able to remove the liver. Now, what did I say initially? That we can remove 70% of your liver without any ill
Wow.
effect on the thing. So
Okay.
even if it is a large tumor, we evaluate the patient, we can look for surgery, and we can up to 70% of the liver we are able to remove. We can peacefully go remove the liver. Initially, definitely liver surgery is very complicated. So it is very, very important that you go to a specialist who's trained in liver cancer surgeries. And that I would say is the most important thing about the safety of surgery. Go to a specialist who's experienced in treating liver cancer. If you are a surgical candidate, they will do a very safe surgery. And right now we can do it laparoscopically or robotically as well.
Wow.
Yeah, exactly. Now, let us say for some reason the patient is not fit for surgery. Now, let us say he has multiple tumors in both sides of the liver, or the patient is old, or he has a cardiac condition, he has a lung condition, or a kidney failure condition. So, here the surgery might not be the safest option. So, here what we do what is known as locoregional therapy. What is locoregional therapy? The first one is angioembolization. So, what do we do over here? Just like how you would do a coronary angio, we probably go to an angiogram, we go into the artery, we go into the artery which is feeding this tumor.
Feeding the tumor.
Yes, so we call it a feeder vessel. Then we give high dose chemotherapy into that artery so that the entire chemotherapy gets concentrated in the tumor and damages the tumor. And when we are coming out, we actually inject either a coil or a foam to block off the artery as well. So now what has happened to the tumor? The tumor is not getting blood supply and there is chemotherapy drugs over there. The tumor gets destroyed.
It cannot grow.
It cannot grow. Now, again, it is very important to know this is not a curative treatment. It is a controlling treatment. Yes. So this is when do we use this? We use this when the patient is not a candidate for surgery, or let us say the patient is waiting for a transplant and we don't want the tumor to grow when he's waiting for
and spread to the other places.
Other organs. So that is when we will take it. Now, if you're not able to do TACE, we do what is known as TARE, which is radioembolization, transarterial radioembolization. So in this, what we do, we again go to the artery and inject radioactive substances into the tumor. And what is going to happen to the tumor cells? The radiation is going to really prick all the cancer cells and it is going to destroy the tumor. Now, along with TARE, we can actually give external beam radiotherapy from outside radiotherapy. We can target that particular area of the liver where the tumor is and target that one as well.
Brachytherapy.
From brachytherapy. Now, let us say the tumor has spread beyond the liver. It is not limited to the liver, it has spread beyond the liver. Then we give what is known as systemic therapy, meaning something which enters the bloodstream and goes and destroys the cancer cells elsewhere. So, how will we know this? We do a PET scan, and PET scan generally will pick out wherever the tumor cells are there. Then we can give oral therapy, which is either in the form of lenvatinib or sorafenib. They have to take 2 tablets a day, morning once and evening once. And this generally has proven it has a very good effect on these tumor cells. And again, for patients who are not fit for surgery or who have developed metastasis or who are patients who are waiting for a transplant. Now, the next generation is the immunotherapy. So, what is immunotherapy? They have made antibodies which are very, very specific for your liver cancer cells. And this is an injection which you need to take once every 3 weeks. It will go target those liver cancer cells, whether it is in the liver, whether it is in the lungs, whether it is in the brain, in the bones, wherever. It will go target these liver cancer cells. And we've had very good results with giving immunotherapy. Now, the father of all surgeries are there. Now, let us say all of
transplant.
Local control. So, what is the father of all surgery? We take out the entire liver. We replace it with a new liver, which is a liver transplant, which is probably the most common surgery we do for liver cancer patients.
But that too when they come in the advanced stage.
So they need to come in what is known as criteria. There are certain criteria there, like Milan criteria, UCSF criteria. There we have a criteria for the number of tumors they should have, what is the size of the tumor, everything. So criteria. So if at all they come within this criteria and we're able to do a liver cancer transplant for the liver cancer, the results are same as somebody who did not have liver cancer. So that is the advantage of picking up liver cancers early, because the treatment options just explode for you whenever you come with early liver cancer. Now, let us say you are under surveillance and now you come to us with a tumor less than 3 centimeters or 4 centimeters after this one. You really don't need any of this. We do what is known as an ablation technique. Either radiofrequency ablation or microwave is there, where we just put a small needle into your tumor CT guided and we burn away the tumor.
Oh,
it increases the temperature of the tumor beyond 110, 120 degrees centigrade, and only the tumor area goes away. You can come in the morning, by afternoon, you can go back home
oh,
happily.
wow.
But
Okay.
all of these can be done only if you catch it early, and this is the
Early in the
importance of
first stage. Yeah,
surveillance.
surveillance. So wonderful. Really, really wonderful, And the technology, techniques, everything is advanced so much. And the people
Absolutely.
like you, who are experts in that, you
Yeah.
are doing marvelous job. So
Thank you.
gone are
Thank
the
you so
days
much,
when
sir.
the liver cancer means that's the end of it.
Yes.
So instead
Yes.
of burning the body, you're burning the tumor inside
Yes,
so that
three
they
centimeters
live.
we burn.
Yeah,
Yes.
that's so nice, so wonderful.